Neck pain and tension headaches are common ailments that we see at MMT. So we're going to kind of go through a little bit of what it looks like for treatment at MMT for those. One of the biggest things that we want to go through first is history and exam. So we've already gone through history. We want to make sure that we're dealing with tension headaches and headaches that might be coming from muscle pain. We also go through, during our history, we go through lifestyle, which includes diet and exercise, because those things can also impact on tension headaches and neck pain. So with our patient here, we've already kind of gone through that. So on our typical, after we get through those, is we're going to make sure you're the right fit at MMT. So making sure that manual therapy, adjusting exercise and nutrition are something that can help your headaches. One of the things that we're also going to go through in this series is with our physical therapist and how we integrate care with Jessie. Jess is my go-to for TMJ type stuff and orofacial pain. And so if I see something that kind of comes up and it's nothing that I can, that needs a little bit more in depth on that, I'll refer out to Jess for that type of care. But we'll just kind of work through some soft tissue, kind of find some trigger points in this patient. We've got some trigger points kind of going on through the upper back and neck. So go through some soft tissue things. Some of the other things that I kind of find with her is some shoulder pain and shoulder tension. So if the shoulder is too tense and it's not moving as well, what it can do is anchor on the neck. So instead of anchoring on our great rib cage that's great for support, we'll get this, and this is where we see these common trigger points through like the trap. This leads to things up into the neck and leads to this tension that kind of radiates across the neckline here and then even into the temples. So we'll go through some massage, some manual therapy, kind of work through that. And then for her, our big thing is to get through this upper back tension. So she might not even need cervical manipulation. So not on every patient that I see with headaches. Some people just can't tolerate the manipulation very well. So we don't do it. We'll work a lot of like mobilization, soft tissue work. And then on some patients that we can tolerate cervical adjustments well, we can kind of go through that as well.